Okay, so similar thing. Actually, the after they misplaced it. After's on the left. Before is on the right side.
Okay.
So what would you guys? I'll start with Romton. What would you?
So yeah, from the redness on the after, I would say she definitely got some sort of laser surfacing or some sort of tightening device to her face and neck. Lips look enhanced. The distance from the nose to the upper lip looks shorter, so that looks more youthful and aesthetic. Upper third of the face has been lifted, I would guess neuromodulators, and maybe even some along the jawline. Nice job.
Gino?
Yeah, I think the skin quality looks amazing, so kudos for doing that for her. Again, she looks relatively young, but start looking a little bit tired, a little frumpy. But I can see, again, you do a great job in giving that really beautiful triangle of U shape. The jawline, I love the way you always do jawline, and the chin, so she looks so much refreshed. Definitely a few years younger, even though she's young, but definitely looks like a younger version of herself.
I'm sure you're recommending a non-invasive regimen to her for her hair because it looks beautiful. It's gorgeous and shiny and full and thick. So maybe she's using low-level laser therapy or.
We actually use Nutrafol for most of our
I was going to say nutraceuticals. So Nutrafol,
which I'm on as well too. No plug for it, but it's.
It does work. I mean,
Me
great
too.
practice.
I take it just for prevention. You never know.
And I
Oh, it
take
totally
it.
does.
I take the Nutrafol for women. I think we all actually
Great.
do.
I mean,
It works great for everyone. Yes.
Why wait until your hair is not good quality? I think.
No, you have to be proactive, and so that's super smart. And such great nutraceuticals. Nutrafol is definitely an excellent choice. Excellent choice. Low-level laser therapy, something she could do at home in the comfort of her own home to really stimulate good functioning from the follicles. And if she did need PRP, that's something we would do once a year in the office.
Yeah, I think very minimalistic approach to this one, just to get her to the after. Skincare regimen, maybe some microneedling with some PRP, some periocular, the rhytids there. The lip definitely looks enhanced, which helps her profile. Again, looking at the true vertical line and the profile enhancement, and some chemical peels possibly. But I think very little, if any, or maybe not even any filler was used in this case.
Right.
Except for the lips.
From looking at this, what I see, what catches my eye is the way that you actually have contoured the nose, and she has much more definition on the nasal bridge, and if that's the result from the skin tightening or the result of enhancement with the fillers, I think that's actually a very good result. She definitely looks much more angled, contoured, and she has definition in her face, which she didn't have before. So that approach to me would be a combination of chemical peels, laser light therapies, as well as radiofrequency microneedling, because I think that's a great energy for tightening. And then the filler, for me, I tend to do a combination of fillers. I actually layer my fillers depending on if I'm trying to go ahead and do the contouring for the jaw and the cheekbone. I will go ahead and layer the radius and then Voluma on top of it, or combine with Sculpture throughout, because the Sculpture also, what's nice about it is also enhances the quality of the skin that I've seen.
You're talking about biostimulators. A lot of times what we'll do, depending upon our patient's age and so forth, and what they want to accomplish, it's very, very common for us to actually combine things like PRP actually with her fillers. So here, the redness, unfortunately, she actually didn't get a chemical, or she didn't get a laser, she got chemical peels. She went out in sunburn, unfortunately. So sorry guys, this is not from any of that stuff. I actually did nothing to the nasal bridge. Improvement in skin quality was a series of basically a good skincare regimen, chemical peels, as well as microneedling with PRP. And also too, I'm a big fan of restoring volume to the mid-face, and then going back down. TJ, I think you pointed this out exactly. Her lips obviously have been restored. Trying to create that V-shaped look. And again, I look at starting at the chin point. I look at the width of the jawline as well too. You're seeing an oblique view, so you can't tell. But she did not need any narrowing. If I do, and this is very, very common, I'll use a neuromodulator to actually try to kind of narrow that jawline in and really restore that heart shape or V shape look. So that's what we did here. So I mean, pretty straightforward, pretty simple combination approach.
How many syringes of filler do you use to restore the big face at the chin? If you
You know, someone this age, usually about 2 or 3.
2 or 3, beautiful.